Good morning, and thank you for joining our weekly COVID-19 briefing. Today's briefing will run until 10:30. As always, we're joined by Acting Health Commissioner Dr. Cheryl Bedigal. As a reminder, members of the public who would like to watch today's briefing are directed to view it on our live stream on the Health Department's YouTube channel. As always, we will present remarks first in English, then in Spanish, then open up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions, and that we limit the questions to 2 or fewer due to our limited time. If we have time for a second round of questions, we'll allow that. Please keep your questions focused on the topic of the COVID pandemic and the city's response today. With those instructions out of the way, Dr. Bedigal, can you please kick us off?
Sure. Good morning, everyone, and thank you all for being here. We are watching the numbers closely to see if the recent mask and vaccine mandates have had the impact we hope to see on case rates, hospitalizations, and vaccination rates. If the mask mandate is going to work, we should see a leveling off of infections in the next few days. We've already seen a small increase in vaccinations since the vaccine mandates were announced, and are hoping that the recent full FDA approval for the Pfizer vaccine will add to that increase in the days and weeks to come. That good news on increasing vaccinations means that Philadelphia will likely hit 80% of adults vaccinated with at least one dose and 65% of adults fully vaccinated by the end of this week. But for the first time in months, more than 200 people are in Philadelphia hospitals with COVID. Even with our high vaccination rates, too many Philadelphians remain at risk. I'm hearing from many parents who are very worried about their children as they look forward to the start of school next week, and as we all hear about surging rates of pediatric hospitalizations around the country. So I wanted to take a few minutes to update you on the public health science of what is needed to get our city's children back to school safely and to keep them safe during this difficult time. Essentially, when we have a population that is vulnerable and cannot be vaccinated, we need to wrap that population in layers of protective strategies. No single strategy is perfectly protective, but the combination works well to reduce risk. This summer, I've met weekly with our school and camp team leader to understand where cases are happening and where our layers of safety have broken down. Time and again, the answer is at home. We see this in our overall data for the city as well. 2/3 of people diagnosed with COVID who know where they were infected were exposed in their own homes by family members, friends, and other visitors. Why? Because home is where we let our guard down. We don't mask and we don't keep distance. Vaccines are clearly our best weapon against infection. Although children under 12 can't be vaccinated, the people around them can and should be. Vaccines can also protect teachers and other school staff against infection and prevent them from inadvertently passing COVID infection on to the children in their care. So I'm grateful for the actions of the school district and the school board in passing a vaccine mandate for teachers and other school staff last night. That doesn't mean that vaccines are all we need to do, though. We know that no vaccine is perfect, and that includes the vaccines against COVID. Masking over the nose and mouth, not hanging under the nose or chin. Hand washing, distancing, keeping people who are sick at home, and contact tracing are all critical layers of protection we need to wrap around our children to keep them learning and in school. We're very familiar with those layers, but too often we ignore them. This fall, everyone in our schools, vaccinated or not, will need to mask. And I'm grateful also for the announcement this morning from the Archdiocese on masking in the Archdiocesan schools. Parents will need to commit to keeping sick children at home and getting them tested for COVID, even when that is challenging with work and other commitments. That is how we help to protect each other. The health department is here to help make those tests easy to get and to offer free testing. Our phila.gov/testing site offers many options for testing around the city and can be filtered for pediatric sites. Distance remains important, but we know that our schools cannot open fully with 6 feet or even 3 feet of distance between every child. That makes all of the other layers of protection even more important. Some children have medical reasons that they cannot wear a mask. We will need additional layers of protection around those children to help keep them safe. None of this will be easy, And we know that even with the school's best efforts, there will be cases of COVID among students and teachers, and there will be closures of classrooms, grades, even entire schools. But by committing to layering protections around our students and around the staff who teach and care for them, we can minimize those cases and maximize the amount of time that students are in school, learning, and returning to at least a semblance of normal. Thank you. Now Zelly will present these comments in Spanish.
Buenos días. Las palabras de la doctora Bergo. Estamos observando las cifras de cerca para ver si los recientes mandatos de mascarillas y vacunas han tenido el impacto que esperábamos ver en las tasas de casos, hospitalizaciones y tasas de vacunación. Si el mandato de la mascarilla va a funcionar, deberíamos ver una estabilización de contagios en los próximos días. Ya hemos visto un pequeño aumento en las vacunas desde que se anunciaron los mandatos de vacunación y esperamos que la reciente aprobación completa de la FDA para la vacuna de Pfizer, que se sumaría a ese aumento en los próximos días y semanas. Estas buenas noticias sobre el aumento de las vacunas significan que Filadelfia probablemente llegará a tener el 80% de los adultos vacunados con al menos una dosis y el 65% de los adultos completamente vacunados para fines de esta semana. Pero primero, por primera vez en los meses, más de 200 personas están en hospitales en Filadelfia con COVID. Incluso con nuestras altas tasas de vacunación, demasiados habitantes de Filadelfia siguen en riesgo. Estoy escuchando a muchos padres que están muy preocupados por sus hijos mientras esperan con interés el comienzo de la escuela la próxima semana. Así que quería tomarme unos minutos para informarles sobre la ciencia de la salud pública, de lo que se necesita para que los niños de nuestra ciudad regresen a la escuela de manera segura y para mantenerlos seguros durante este momento difícil. Esencialmente, cuando tenemos una población que es vulnerable y no puede ser vacunada, necesitamos envolver a esta población en capaz de estrategias de protección. Ninguna estrategia es perfectamente protectora, pero la combinación bien para reducir el riesgo. Las vacunas son claramente nuestra mejor arma contra la infección. Aunque los niños menores de 12 años no pueden ser vacunados, las personas que los rodean pueden y deben hacerlo. Este verano me he reunido semanalmente con nuestro líder de equipo escolar y de campamentos para entender dónde están sucediendo los casos y dónde se han roto nuestras capas de seguridad. Una y otra vez la respuesta es en casa. Vemos en nuestros datos generales para la ciudad también 2/3 de las personas diagnosticadas con COVID que saben dónde fueron infectadas, estaban expuestas en sus propios hogares por familiares, amigos y otros visitantes. ¿Por qué? Porque en el hogar es donde bajamos la guardia. No nos enmascaramos y no guardamos distancia. Las vacunas también pueden proteger a los maestros y otros miembros del personal escolar contra la infección y evitar que transmitan inadvertidamente la infección por COVID a los niños a su cuidado. Por lo que estoy agradecida por las acciones del distrito escolar y la junta escolar al aprobar un mandato de vacunación para los maestros y otro personal escolar anoche. Eso no significa que las vacunas sean todo lo que necesitamos hacer. Sabemos que ninguna vacuna es perfecta y eso incluye la vacuna contra el COVID. El uso de mascarillas sobre la nariz y la boca, no colgando debajo de la nariz o la barbilla, el lavado de manos y el distanciamiento, mantener a las personas enfermas en casa y el rastreo de contactos también son capas críticas de protección que necesitamos envolver a nuestros hijos para mantenerlos aprendiendo en la escuela. Estamos familiarizados con estas capas, pero con demasiada frecuencia las ignoramos. Este otoño, todo en nuestras escuelas, vacunados o no, tendrán que mascarillarse. Los padres tendrán que comprometerse a mantener a los niños enfermos en la casa y hacerle la prueba de COVID, incluso cuando eso sea un desafío con el trabajo y otros compromisos. Así es como nos ayudamos a protegernos unos a otros. El Departamento de Salud está aquí para ayudar a que esas pruebas sean fáciles de obtener y para ofrecer pruebas gratuitas. Nuestro sitio de phila.gov/testing ofrece muchas opciones para pruebas en toda la ciudad y se puede filtrar para sitios pediátricos. La distancia sigue siendo importante, pero sabemos que nuestras escuelas no pueden abrir completamente con 6 pies o incluso 3 pies de distancia entre cada niño. Eso hace que todas las demás capas de protección sean aún más importantes. Algunos niños no tienen razones médicas por las que no pueden vacunarse. Usar máscara, necesitaremos capas adicionales de protección alrededor de esos niños para ayudar a mantenerlos seguros. Nada de esto será fácil y sabemos que incluso con los mejores esfuerzos de las escuelas habrá casos de COVID entre estudiantes y maestros y habrá cierres de aulas, grados, incluso escuelas enteras. Pero al comprometernos a poner las protecciones alrededor de nuestros estudiantes y alrededor del personal que los enseña y cuida, podemos minimizar esos casos y maximizar la cantidad de tiempo que los estudiantes estén en la escuela aprendiendo y volviendo al menos a una apariencia de normalidad. Muchas gracias. Thank you.
Thank you very much, Zoe. Now we will move to Q&A. Again, reporters are asked to limit their questions to 2 or fewer, and we ask that you stick with the topic at hand. If there are any reporters who do not get the opportunity to ask questions, please follow up by email and we will get you an answer. Just as a reminder, for any reporters who would like to ask a question, please raise their hand. Right, there we go. First up, we'll go to Sean Walsh from the Inquirer. Go ahead, Sean.
Thanks very much. Is the city still not keeping track of how many businesses are choosing the proof of vaccination route instead of the, requiring mask route? And if not, is there like at least an anecdotal sense of how many people are going that route?
Certainly the numbers are going up, but it's not something we're tracking because when we go to do inspections, either for our routine inspections or any complaint-based inspections, it should be obvious at the entrance. If it's not obvious that they're requiring a vaccine at the entrance, then it's not going to be an effective strategy. So we're not trying to track that in any way, but anecdotally, certainly it's rising.
And since the announcement of the new policy, has the city taken any enforcement action, whether for saying you'll do the vaccine proof and failing to do that, or just not enforcing the mask mandate?
So our inspectors are out and about, again, doing their routine inspections and also doing complaint-driven inspections. Typically, as we do for anything else, the first intervention is a warning and education. I can't tell you exactly how many tickets have been issued at this point, but they are following their usual procedures.
So there have been some tickets that are warnings so far, but no penalties.
I just don't have the exact number for you. We can certainly get that for you.
Okay, thanks. And then lastly, has like the rate of vaccination continued to increase over the lull, in the work of the summer? And do you think that the new rules that the city implemented has anything to do with that?
Yeah, we did clearly see a bump in the week that followed that announcement, and the numbers seem to be continuing to go up. So we had been running for a while pretty steadily at 15 or 16,000 a week. We saw a week of 18, and then we went up to 20 last week. So, it's encouraging. We'd like to see it much higher, but at a time where vaccinations, had been falling off in other places, it's nice to see the numbers go up. It's impossible in public health to ever say this one thing caused that, but the timing was nice to see.
Thank you.
Thank you very much, Sean. Next up, we're going to go to Pat Loeb from KYW. Go ahead, Pat.
Hi, of the 200 people hospitalized, do you have an estimate of how many are unvaccinated or what percentage? And also how many or what percentage are children that are ineligible for vaccines?
So children remain a small fraction of the number of people hospitalized. What's unusual is that children are hospitalized at all. In terms of the vaccinated folks who are hospitalized, the vast majority are people who are unvaccinated. Our data lags a little bit, a week or two. So, I can't tell you of the people currently in the hospital, the exact number, but, overall, the vast majority of people in the hospital have remained unvaccinated here and across the country.
Okay, thank you.
Thank you very much, Pat. Next up, we're going to go to Annie McCormick from Channel 6. Go ahead, Annie.
Hi, Dr. Bedigal. One thing, I apologize. My connection went out a little bit for what the answer to one of Sean's questions in regards to the tickets that you mentioned, or that may have not been the right word. Just basically that you issued some sort of, I don't want to say reprimand, I don't want to put words in your mouth, but to those who haven't been vaccinated in the city. Is that what I heard correctly? And if not, could you clarify?
He was asking about people violating the mask mandate or places that have a vaccine mandate that weren't enforcing. I don't have those numbers, but we can certainly get them if you wanted to know the number of tickets or warnings issued. We can get that information.
Okay, but there are warnings being issued.
So yeah, the environmental health inspectors go out in two ways. They do their routine inspections, and they would include enforcement of COVID-related rules in those inspections. And then they also do a complaint hearing process. So when we get calls, for example, to 311 about a place that isn't following the mask mandate, they would go out. They would initially, do education, issue a warning. But if there wasn't change, they would start ticketing.
Okay, and then for individual city employees that are not adhering to getting vaccinated, does that apply to them as well?
We wouldn't ticket individual city employees. The requirement for city employees to either be vaccinated or double mask kicks in on September 1. And it would be a disciplinary process if they refuse to comply.
Got it. Okay. Separately, in regards to the schools, I'm just wondering, it's still kind of early. They just made a decision yesterday, but is there benchmarks that I'm sure you've been in conversations with the school district? So are there benchmarks that you have put in place or you're beginning to put in place in regards to, let's say, you're saying it's inevitable that kids are going to get COVID. If there's X amount at this point, then that may require a class to either go virtual, or I'm just wondering if there's benchmarks in place to see, if and when you need to either close the school or have a classroom go virtual or whatnot.
Yeah, our school guidance is posted on the gov/COVID site. And it includes benchmarks for, how many children in a classroom, how many children in a grade, if there are cases in grade that are in separate classrooms, when a classroom closure, when a grade closure, et cetera, we need it. That's all public.
Okay, but I mean benchmarks if X amount of kids get sick in a classroom or at a school, are they? I didn't see them on there, but
Yeah, if you scroll down, you should see it.
Okay, all right, thank you.
Sure.
Thank you very much, Annie. Next up, we're going to go to Carolina Rodriguez from Univision. Go ahead, Carolina.
Hello, good morning, everyone. Hi, James. I was wondering, Dr. Bedigal mentioned contact tracing. Since we have a vast amount of patients and new cases, how is that working for the city right now? It's been a while since I heard about contact tracing in Philadelphia.
So, I think contact tracing for the city at large with this many cases is very, very challenging. And so for the city, we're focusing more on the individual cases, making sure we reach out to them, give them information about how to keep everybody around them safe, how to direct people who may want to get tested. But that's different from contact tracing in a school setting where, it's easier to know who was in that classroom when, who needs testing, who's been exposed. That's a different situation. And the contact tracing is part of how we keep schools open and try to avoid widespread infection is an important part of the school guidance.
Does the department still have a personnel for that task now that back to school is just around the corner?
I'm sorry, do we still have what?
A personnel, people working contact tracing.
Yes, we do.
Okay, and my last question, Dr. Bedigal, is about testing for small children, little kids 2 and older. How's that working in the city?
So there are multiple sites around the city that do pediatric testing. So that phila.gov/testing site that I mentioned, there is a filter, a box at the top of the screen that you can check for pediatric testing. And that will just show you the sites that will test children. Because obviously not every site is set up to test young children. The schools also have the ability to do testing in the schools through the school district. The other schools in the city are, I believe, contracting with a third-party vendor to do that through funds that came through the health department from the federal government. So there will be testing in schools as well.
Do you encourage parents to test their children prior the first day of school?
So, in general, we encourage testing for kids who are symptomatic or kids who've had an exposure. Screening testing is useful in certain settings. For example, we're recommending screening settings for sports teams in school where the kids would want to play sports without a mask for unvaccinated kids. We haven't recommended screening every child before the start of school. That would be, I think, a very heavy lift to get done. You'd need to do it all within a couple days of the start of school, and it's a lot of kids. So we haven't made that specific recommendation. But certainly any child with symptoms should definitely be tested. Any child who's been exposed to somebody with COVID should be tested.
Thank you very much. Have a great day.
Thank you, Carolina. Next up, we're going to go to Brian Mendoza from Telemundo. Go ahead, Brian. Oh, sorry, wrong person. There we go.
Sí.
Hi there. Good morning, everyone. I'm not sure if my questions are going to be able to get translated for our Spanish viewers, but Dr. Bedigal, you mentioned that there are over 200 people hospitalized due to COVID. Is there a specific race that is being affected the most at this moment?
So in general, as we—
I'm sorry, Dr. Bedigal, one second.
I'm sorry. Yes,
Zelly,
please.
if we could have Zelly do a quick translation of that question, please. Zelly, if you're still here with us. There we go.
Brian, can you repeat the question, please?
Yeah, I mean, I said it in English. If you could just translate whatever Dr. Bedigal says, that'll be great.
Okay.
Yeah.
We don't want to do that in Spanish?
Bueno, sí, mencionó que la doctora mencionó que en estos momentos hay más de 200 personas hospitalizadas. Entonces solamente quería saber si hay algún específico race que está siendo afectado más en estos momentos.
¿Una raza?
Sí, no raza.
Okay, Dr. Bedigal, you heard the question in English. Do you want him to repeat it or are we good?
No, it's fine. So in general, as has been true throughout the pandemic, we see higher rates of hospitalization among Black and Latino residents than among other populations. The highest rate currently is among Black residents. That may be because the vaccination rate is higher among Latino residents right now.
En general, estamos viendo que las razas que son afectadas es en los afroamericanos y los hispanos, pero ahora en este momento en Filadelfia, el grupo más alto que está siendo afectado son los afroamericanos.
Listo. Y la próxima pregunta es, sabemos que hay un grupo, o tal vez es un pequeño grupo de maestros que no están de acuerdo a vacunarse. La ciudad tal vez está trabajando con el Distrito Escolar de Filadelfia para tratar de trabajar o tratar de coordinar algún otro tipo de opciones para estos maestros que no se quieran vacunar con este requerimiento.
Dr. Bedigal, there's a small number of teachers and educators that do not want to get vaccinated. What is the city doing to ensure that they get vaccinated, and what options do they have?
So as Dr. Haidt discussed last night at the school board meeting, we'll be working with 5 unions to develop plans for medical exemptions, religious exemptions, and then how to handle situations where people are reluctant to get vaccinated. But hopefully, as they see other colleagues getting vaccinated, with the new FDA approval, we're hoping that people do move to get vaccinated. But it'll be a gradual process based on what he works out with the unions.
El doctor Hyde, el superintendente del sistema escolar de Filadelfia, está trabajando para averiguar cómo van a bregar con las personas que no se pueden vacunar por razones médicas o razones que son cristianas o algo así. Entonces, va a bregar independientemente con los casos, pero esperamos que como ya la FDA aprobó la vacuna Pfizer, y mientras los maestros ven que otros maestros están siendo vacunados, que puedan vacunarse.
Brian, is that everything?
Yeah, I was trying to unmute myself again. Thank you so much.
Thank you, Brian. Next up, we're going to go to David Melandra from Philly Sports Zone. Go ahead, David.
Dr. Bedigal, I got a couple questions for you. One, since the mask mandate went into effect a couple weeks ago, have there been any reaction from the Eagles or the Phillies about anybody not following the mask order?
Sorry, somehow I muted myself. I have not heard anything from the Eagles or the Phillies about people not masking at Eagles or Phillies games. There was an incident in which there was a concert at Citizens Bank Park that did not have people masked when it should have. And we've talked with them about that, and that will not be repeated.
Okay, and with this variant still going on, will the city still allow, say, tailgating going on for the Eagles and the Phillies going forward, or is there concerns about allowing that to go on?
So currently there's no rules that would prohibit tailgating. We are, as I've said, watching numbers very carefully, throughout this. I don't want to take anything off the table. We will be as little restrictive as we can based on the numbers of cases. So for right now, there are no rules against tailgating. That doesn't mean that there wouldn't be later in the season, depending on what's happening.
Okay, and my last one will be about for high school students. Like, should they be tested before every game, or how would you recommend for all the high school students?
Yeah, we do have specific testing recommendations for any unvaccinated team players in high schools. And those are listed on our site. Excuse me. But it involves twice weekly testing routinely, and I believe there are requirements for tests before games. We can double check that and get back to you, but I believe so.
All right, thank you.
Thank you very much, David. Seeing no more hands raised and us bumping up right against 10:30, I'm going to conclude today's press briefing. We'll announce next week's briefing by Twitter and media advisory when a time and date are set. Thank you again for joining us.